Welcome to another episode of Women in Focus. It's been a trend this year, this particular season, that we've been interviewing people who have written books and are very accomplished women. Our woman in focus today is a physician. She's also written an amazing book called Mind Body Cure. It's a lovely book, and I have been given a copy of this book. And we're going to be talking to her about mind, body, and then how to cure it. You're most welcome in our program, Dr. Bal Pawa. How are you doing?
Thank you, Sushma ji. Pleasure to be here today.
It's lovely to see you. I've followed your profession. We've interviewed you on radio as well with Dr. Arun Garg. Amazing. Tell me about this book.
This book is a passion project. I started writing it 4 years ago. I had no idea at that time that it will be released at the time of a pandemic of stress. I had no idea. But the reason I wrote the book is because I had a very important message to share. As a physician and as a patient, I became a patient. And I see that this wonderful medical system we have is great for intervention. But when it comes to prevention or involving the patient in their care, there's a deficit. So I wanted to tell people that they have to take charge of their health. Their best doctor is inside of them.
Right.
We have an innate ability to heal ourselves, and this book is showing you I had to do it as a physician to navigate the system, and I want patients to learn how to do it as well.
So when you said you are a physician and also a patient, how did you become a patient?
Well, at the age of 32, I was leading a very active, busy life, mother of 2 children. I had one on the way, busy doing deliveries.
Right.
I love doing deliveries at obstetrics. And I was working at Burnaby Hospital. I delivered a beautiful baby boy. Mother was very happy, and I couldn't wait to go home and see my own 2 children. So on the way home, I had a very terrible accident. It was a head-on collision.
Oh my God.
And with a truck. And then I was wheeled back in the emergency room to the same hospital I just left.
Yeah.
So now I'm coming back as a patient lying there, and I just left as a doctor. Now I'm back as a patient.
Wow.
And that began 7 years of hell, really, for me. My life changed completely.
Wow.
I couldn't deliver babies. I had fractured my shoulder. I had so many surgeries. I lost everything from where I was. I went down there. So 7 years, just medication, drugs, surgery, and I struggled, and I saw how people struggle with chronic pain, the loss of my baby, the anxiety, all of those emotions, physical and mental, accumulated. And I wanted patients to know there's a better way. Just don't keep taking drugs. Don't keep taking more surgery. That was going to be my future. And I said, no, I'm not going to accept it. There has to be a better way. And that's when I transformed my health. And now I've helped to transform the lives of thousands of other patients.
So you said, as a doctor and then as a patient. So you've seen both the sides. Many people don't get to see both the sides, so you understand it. And you also said that our bodies are meant to heal. So are you saying that our mind is so powerful that we can tell our body that there is no pain and the pain goes away?
It is that powerful. If your mind can make you sick, your mind can also make you well. But most of us are stuck in what I call a loop. And I was stuck there. I was stuck with chronic pain from my neck and shoulder and the emotional of losing everything. So I think that when I realized after doing my transformational course, which I'll tell you about, I realized how powerful the mind is if we use our mind to heal the body. 75% of the symptoms that walk into a doctor's office can be attributed to chronic stress. And where does stress come from? Our mind. So if we can learn how to master our mind, control our stress hormones, we can then start healing our body. And that's very powerful.
So you also said beautifully that, started writing this and it got released at the time of this pandemic when everybody has got COVID stress.
Yes.
And that stress has become or manifested into fatigue for people,
Yes.
depression in people, and probably, worth nothing, or, they've got this feeling that they can't do anything in life, because they're sitting at home.
They're feeling helpless,
Yeah.
right? Because what you have to realize is there are only two systems. Our nervous system can only process two things, fear or trust. Our nervous system is made of hormones and nerves and is located in the back of our head. It's very primitive. And our frontal part of the brain has highly developed. If you look at, man thousands of years ago, it was a very small brain. But now look at our brain. We can put man on the moon. We have artificial intelligence. We have all this technology. So sophisticated. But our primitive brain has not changed at all. From thousands of years ago, it's the same brain that processes stress. We used to run away from tigers,
Right.
and that system helped us to escape danger, fight or flight.
Right.
So that same system is carrying your fear. So if you have fear, uncertainty, rejection, fear of loneliness, fear of failure, fear of a toxic boss,
Right.
all of those things are traveling on one pathway, the same pathway as we used when we ran away from tigers.
Does it manifest into totally different ailments then?
Yes, so then when stress shows up, if your cortisol, adrenaline is on all the time, it's going to show up. Some people say, I have muscle tension, hypertension, insomnia.
Yeah.
They can't sleep at night, or they develop irritability and mood problems, depression. I've seen many people with gut issues, heartburn or irritable bowel syndrome. So, and if this chronic inflammation stays 10 years, 15 years, then diabetes and even cancer and arthritis, inflammation. So basically, if you don't break this cycle and fix it, in 15, 20 years, I've been doing this for 30 years, and I'm seeing patients on the other end, when they don't heal their stress, they end up with chronic diseases. It's a well-known fact. It has been researched extensively, but we as physicians are not addressing the root cause of the problem.
I want to come to that because it is the root of everything that you have been talking about, right?
Yes.
So
yes.
I want to take you to your childhood, but let's take a short commercial break.
Okay.
Because it'll tell me why you wanted to write this book and why did you want to become a physician. And
Okay.
I understand that one of your children is also a doctor.
Yes.
Dr. Bal Pawa is our Woman in Focus today. Don't go away. We'll be right back. Welcome back to Women in Focus. Dr. Bal Pawa is our Woman in Focus, the mind-body cure. Am I correct in understanding that this would have something to do with holistic way of curing yourself?
It can be considered holistic, but I prefer the word integrated.
Okay.
Integrated means our body is a beautiful system that works together. It's not just a sum of its parts. It works as a beautiful symphony together. And so integrating the mind and the body is key. Don't treat the body separately and the mind separately. They are seamless, integrated systems.
So would that go back to a little bit of Ayurveda as well?
Ayurveda is also looking at your body energy. They're using certain herbs and supplements to calm your energy. So when I talk about the nervous system, fight or flight or rest and repair, they're energies also.
Yes.
So yes, indirectly, there is a relationship.
So as a child, did you always wanted to be a doctor?
I knew that I always wanted to do healthcare.
Did you really?
Yes, I was very young, even in my yearbook. I was 16 when I graduated from high school.
Wow.
And it's written medical field. So I wanted to be a nurse. I never thought about being a doctor. I thought I'll be a nurse, but I was too young. And they said, you have to be 18. So I said, what am I going to do for 2 years? So I did pharmacy program.
Oh, I
so I
see.
became a pharmacist. I worked as a pharmacist. Then I said, I love doing this, but I don't want to just be behind the counter. I want to be directly with patients. I love people.
Right.
I'm genuinely interested and I want to help others.
Right.
So then I applied to medical school and finished medicine, and here I am today. So it began with a aspiration for nursing.
Well, could that be because, as young people, we usually see doctors as men and nurses as women.
Maybe at
know?
that time, so that
Yeah.
was many years ago, so over 40 years ago, maybe at that time there weren't that many women in medicine. And now I teach at UBC Medical School and I see 60-70% of the class size is women.
Is women. So were you born here?
No, I was 6 years old. We arrived in Newfoundland from India, Punjab. My
Okay.
parents were both school teachers.
Right.
And they came to teach in a small town. My dad thought he's coming just for a year.
Uh-huh.
And here we are 50, 60 years later, we're still here.
And is that you did most of your education in Newfoundland?
Yes, at Memorial University.
I interviewed another doctor, and they were in Newfoundland, and people from Newfoundland, they just they fell in love with all those people. And if they could go back, they wanted to go back to Newfoundland because it's such a beautiful place. People are lovely too.
Oh, it was a wonderful experience.
Yeah.
They embraced, there was no racism. They
Yeah.
embraced our family.
Wow.
And we got such a multicultural experience. I think if we had come to Vancouver,
Yes.
A lot of immigrants tend to hang out together.
Yes.
And they don't really grow.
No.
But my parents said, just assimilate. I went to the local community church. I went to volunteer. I was singing in the choir. I went to camp. I was completely immersed in the culture. And it really enriched me and opened my perspective. And my mother as well. She joined the United Church. We didn't become Christian. We kept our faith at home. But they wanted us to explore everything and be exposed to it. And I
Right.
think we were much better for it.
Or richer by doing all that,
enriched.
right?
I
Yeah.
agree. Yes.
So how many in the family, how many siblings?
I have 4 other siblings, so I'm number 2. I have an older brother and 3 younger siblings, and four of us are in Vancouver,
Right.
and 1 is still in London, Ontario.
And everybody in medical?
No, my brothers are 2 are engineers, and 1 is an optician, and my sister's a dentist. Her husband's a dentist.
So
yeah.
being brought up in Newfoundland and parents both educated, I am hoping that they were not very strict with you guys as far as dating or anything like that.
Oh, they were pretty strict. They were very strict. They wanted us to immerse, they wanted us to embrace the culture and learn from it, but they were very strict, especially with the girls at that time, this 40 years, they said, you know, the boys can go to school dance, but the girls can't. So that was very much there. But when it came to education,
Yes.
my parents didn't hold me back. They encouraged me.
Yeah.
They said, doesn't matter, you're male or female, we'll support you all the
Right.
way. And they did. That was very encouraging.
Is that beautiful?
Yes.
So then it must have been difficult to, meet guys. Was it an arranged marriage with your husband?
Well, it was such a coincidence. You might remember Mr. Neil, Mr. Gurdal Singh Neil.
Very well.
So he was visiting Newfoundland, and my father saw this man with a turban walking on the street, and he brought him home. And I happened to be practicing on my harmonium playing kirtan because we were the kirtan ragis there. There's no other ragis. So my sister and I were there. They were very happy.
Yes.
So Auntie and Uncle Neil came,
Yes.
and then they said, when you come to Vancouver, you must come and look us up. So my father and mother looked them up, and
Right.
then they made some introductions. So I met my husband in Vancouver
Beautiful.
through the Neils.
The Neils are, when I came here, they were the only people I knew because my uncle, my mamaji, and Mr. Neil both taught together. They were both teachers in Kenya.
I see. Yes.
And so he was my mamaji,
Oh.
So losing him was very sad.
That was very sad.
But he lived a beautiful life.
He was
Amazing life.
Yeah.
So you met your husband through them.
through them in 1987. And then in 88, I changed my whole program. I was supposed to be in Ottawa doing endocrinology.
Right.
So in 87, I was doing my interview. Then I met my husband. 88, I changed everything, came to Vancouver, and then did my internship at Royal Columbian Hospital.
Beautiful.
And then joined Burnaby Hospital to do obstetrics. So
Now, being married, and so it was within your own faith, right?
yes.
Yes. So is he also in the same profession?
Yes, my husband is Bal Pawa. He's an optometrist, and he's been here for 35 years, and we had a lot of things in common. I was
Right.
growing up in Newfoundland, he was growing up in Alberta, his parents were teachers, my parents were teachers, And so we just really bonded immediately because we had a lot of things
common.
that in common. Yeah.
That's right.
Yeah.
I want to talk to you about kids and also the future. I mean, you've written, is this your very first book?
It is actually my second book. The first one's not published yet. The first book is about my dad, the story. He had a very interesting
I
story
bet.
from partition to Canada and his legacy of interfaith. So I'll finish that book next. It's about 80% done.
Let's talk a little bit about that, because interfaith beliefs and faith beliefs are very important for us. They are our foundation.
Right.
And if we keep that foundation strong, then we can grow, right? I believe
agree.
in that.
Yes.
Let's take a short break and come back and talk to you.
Okay.
Dr. Bal Pawa is our Woman in Focus today. Don't go away. We'll be right back. Welcome back to Women in Focus. Our Woman in Focus today is Dr. Bal Pawa. You know, you and I should be talking more. I mean, I'm in the third part of this interview, but there are a lot of different topics that you and I can talk about. So we got to the point where you got married and you were going to have your first child.
Yes, that's right. My first child was Sean, and he's a practicing physician here in BC now. He's an emergency room physician.
Wow.
So he's on one end of the spectrum. He's doing interventional medicine.
That's right.
And I'm really trying to focus on prevention. And we both have had great discussions, and I talk about in the book that you need intervention. When someone's really sick, you need life-saving, you have to go to the doctor, you have to go to emergency. So I want people to know that you need your doctor, but when it comes to prevention, you must take back your power and reclaim your health and use your innate ability to heal yourself and prevent disease by using your mind.
Is it difficult? Is it easy?
You know, the first step is becoming awareness.
Okay.
The awareness piece is so important. People go through life just waking up every day doing the same thing, and they want different results, but they're doing the same thing. That's insanity, right?
Yes.
So if we want different health, we have to think different thoughts, because thoughts are the language of the mind. Feelings are the language of the body.
Right.
So when the doctor says, how are you feeling? You say, I'm tired,
Right.
I'm depressed, my stomach hurts. That's your feeling. So if I want to change that, I have to go back and say, what was going on in your life? What were you thinking? What's your mind doing? So I have to go back to the thoughts, change your mindset, then change your health. And this formula works for almost everything. Of course, if you have injury, you have infection, those are different things. You know, but 75% of the symptoms you can fix by reducing the way you think about it and changing the way your body shows up.
Okay, give me an example.
So for example, let's talk about stomach pain. That's a common one. You see the number of people who are taking pills for antacids. Zantac has now been pulled from the shelves.
Right.
So what happens is when you're under stress, your body's sending cortisol and adrenaline. It takes the blood away from your gut, stops your acid secretion, stops the movement, so now your gut is not functioning properly. So if you're waking up every day in stress, you start developing heartburn, stomach pain, muscle spasm. You go to the doctor. He says, well, take this pill, take this pill. He doesn't have time to ask you what's going on, and you say, well, what's happening? Well, my relationship is terrible, we're broke, my child is on drugs. You know, they have so many stressors. So then we have to go back and fix how they are showing up with those stressors. We can't fix their life, but we can fix the way they show up mentally and emotionally to deal with their stress. And then I show them that you can change that, get your stomach back to normal, do some relaxation. Of course, you might need support, but you need to change the way that your mind is processing the information.
You just mentioned this. This is all in this book.
It's all, there's a chapter right on the gut on how to cure
body,
it.
and cure. So the cure to heal your pain, anxiety, fatigue, all that is made by ourselves, for example.
Many, 75%.
Many of them. Okay.
Yeah.
Unless, I mean, I go and hit myself and break my elbow, that's different.
That's a different thing.
Yeah, but the anxiety that is giving birth to my heartburn is my own doing.
Yes, in most cases it is.
Yeah.
And then you have to think, when your mind is stressed, you make bad choices. So a stressed mind will drink more alcohol, drink more coffee, choose bad foods. They don't sleep properly. They don't exercise. So a stressed mind makes bad choices for all the three areas. When we say to the patient, eat properly, go to sleep on time, and exercise. But if the mind is stressed, they're going to make bad choices. So the first step is to calm the mind, make them grounded, make them aware, help them connect the dots, and then do all those three things.
Dr. Pawa, you know, you've written this whole big book, and it's small print as well.
Oh, there's an audio book.
And where can one get this book if one wants
You
it?
can go to any bookstore.
Yeah.
They sold out on the first day because of the pandemic of stress, but it's now restocked, and Amazon.ca has it as well, and Indigo Chapters, Barnes Noble. It's available everywhere.
Everywhere. And do you feel people, if they started to look after their stress and calm themselves down a little bit, they could then think maybe deeply about their issues and maybe find better solutions?
Absolutely. That's a great point, actually. When your mind is calm, you tend to think more creatively, because left brain is survival brain, right? You're always, cortisol, adrenaline is making you do something very drastic to get out of the way of danger. So you don't make good long-term decisions. But if you can shift your brain to a calm brain, into rest and repair, your nervous system shifts, your heart rate slows down, you breathe deeply, you will think more creatively and more productively. You make better decisions, you come up with solutions. So that's why conscious living, being grounded, being in tune with your body, and integrating the mind and body makes sense for not just medical issues, but just your relationship issues, for all the other issues in your life. It's a complicated life we have.
It is, and we make it even more complicated. Thank you for being our Woman in Focus today.
It was a pleasure. Thank you.
Dr. Bal Pawa has been our Woman in Focus today. Don't go away. We'll be right back.